Hey guys, welcome back to my channel. I'm Dr. M, a GP in the UK. So in this video, we'll be talking about my journey as a GP, but really focused on the training, being a GP trainee and how I managed to get through that. So this video will really be helpful to people who are considering GP as a specialty, or people who are already in the training process or program, or people who have just started the training, GP training. So congratulations if you have just received your postings, your rotations, or you've gotten the, go ahead to start as a GP trainee. So this video will really be helpful because I, as an IMG, an international medical graduate from Nigeria who came here, 5 years ago to start working as an acute medicine trust grade doctor and progressing to GP training and then becoming a GP. I think I have earned the right to advise you on things that really work for me, and hopefully that will be so handy for you in your journey. So let's dive in. GP is a specialty, and just like every specialty, you have to ask yourself why. Why am I choosing GP, right? So for me, it was not a very simple question to answer because I always wanted to be an internal medicine physician. Anybody who went to school with me, my colleagues, my classmates in school, I always really shocked I went to the path of being a general practice physician. But then every time I asked myself whether I did the right thing, I know I did the right thing because that is why I'm here. But then answering that question, when I started working in the UK as an acute medicine trust grade doctor, I liked it. I really wanted to, continue in that path, but I did not quite enjoy working in the hospital. I know that people talk about, working in teams and the whole thing in the hospital. You see less patients compared to an average GP, you see less patients in the hospital. But then I did not really like the way the hospital ran. I didn't like nights. I felt it was sort of cruel in the UK because coming from Nigeria, if you're working in night shift, for example, you did have decent call rooms and they made sure you had at least warm food, but that wasn't happening in the UK hospitals. So, and also one thing that really changed the game for me was when I went to work one day. I think I met this GP who came in. She brought a patient. I don't know how she ended up in the hospital, but she came into the call room and she was looking all so dressed up, looking so chilled. I love the aura around her. And then subsequently, I started to notice some other GPs who would come maybe for a short shift because we were quite close to the urgent care center. And the kind of calmness they radiated and the way they work through their patient load and their clinical acumen, I really appreciated it because I wondered how they were so versatile in knowing a lot of things. And to me, that really shaped my thought process and helped me to make a decision. And I decided that, I'm going to do GP, not just because of the autonomy GP gives you, not just because of the variety of cases and, the kind of continuity of care you have with your patients, but really because of the way they presented themselves. And I just liked it. And I said, I'm going to consider that as a specialty. And here I am thriving. So you need to ask yourself that question. Do you know, people have actually asked me, what kind of doctor are you? And I said, I'm a GP. And then they follow it. So what are you going to specialize in? I'm like, GP is a specialty. It's always so funny to me. I have to explain that this is actually a specialty, especially my folks back in Nigeria. I have to explain to them that, do you know anything about family medicine? And they always know that there's family medicine as a specialty. But I think in the UK, they've just made it look like it's not really a specialty because you don't get the specialty register, especially, but that's by the way. Anyway, so moving on. How did I start my whole process? I started with the MSRA exam. That's a multi-specialty recruitment assessment exam. So you do write that. I did that in 2020. And I did well in the exam. I managed to rank. So the first thing I'll tell anyone as a GP trainee is to get your rankings right. There's no guarantee. Where during my own time, in my own deanery, they didn't give us exactly what we ranked, but at least they will give you maybe your first 3 rankings. You're quite sure that you will get it. But then I will not lie. I was a bit careless with it because I wasn't really sure what I wanted to do. I knew I didn't want A&E. right? Because I've worked in acute medicine and we were quite close to the A&E departments back in where I was working then. I knew I didn't want A&E, but then I was not quite sure because A&E was featuring in most of the rankings with GP rotation, because I know it's changed now. You have 18 months of GP rotation and 18 months of hospital rotation. So for your hospital rotation, some hospitals did 6 months. So you have 3 rotations within the hospital in different specialties. And then you have 18 months of which you spend 6 months in the GP surgery that is not your training practice, because as a GP trainee, you're assigned a training practice. And what that essentially means is that wherever your trainer is where you're going to end up in your final year, right? That is what it is traditionally. But I know some people have some sort of deviation. But generally, I think now it's changed where you have 1 year of hospital rotation and 2 years in the GP practice, depending on where they put you. So mine was 18 months of hospital and 18 months of GP. So the way they ranked it in my deanery was that they had 3 hospital rotations and 1 GP rotation, right? So each of the hospital rotation you had to spend 6 months. So they might do A&E, psychiatry, obs and gynae, and the GP rotation. So that sort of ties it up. And the next slot might be A&E, pediatrics, psychiatry, and GP. So they give you like 6 options, and then you rank it depending on what you want. So I think they gave me my third pick, which was A&E, obs and gynae, psychiatry, and then obviously GP. So the first thing I started with was obs and gynae, which was actually a good way to ease into the whole process, right? So that's one thing you need to do your rankings. And then while I was in the whole process, I still had other things to do, doing your whole paperwork and all that. So that sort of went past quite fast. And then I moved down to my training location, whatever it's called. So that involves some moving, but that's by the way. And then after that, I had to meet my trainer. This is very important. The meeting with your trainer, I feel like it sets the tone for the rest of your training. Because if you have a trainer who is invested in your training, that is when you know. So when I set out to meet my trainer, we had a meeting and we talked about my journey as a doctor. Even really as a medical student, he wanted to know what kind of student I was. Because training is like you're actually going back to school, but it's like adult education, right? Now you're not being given pocket money. You're sustaining yourself, you're working, and you have to learn. You have to pass exams. So he actually took me back to my medical school days. And the first thing he asked me when it came to exams was, do you know how to pass exams? And I was like, why is this man ask me this kind of question? But every time I think about that question, I find it so relevant because you might know, you might be very knowledgeable as a person, but passing the exams is a different ballgame. And it helped me to understand the kind of person I was, because at the end of the day, I understood that I know how to pass exams after we had that chat. So meeting with a trainer is really highly recommended. You get to know whether you people fit, if the person is your right fit at that point. They identify what your learning gaps are and help you work through it. So for me, the meeting with my trainer, he narrowed my focus and he told me some important things that were really helpful. One was that I know you're starting with hospital rotation. The temptation is for you to think that you're you're a hospital doctor, you're a GP trainee. So the most important thing is that you need to know how to maximize your training, your rotations in the hospital. I'm not going to A&E to be an A&E registrar. I'm in A&E as a GP trainee. So whatever it is I'm learning, whatever it is I'm trying to get out of it should be beneficial to me as a GP. I'll throw more light on this as I go on. He emphasized the need to develop a personal development plan, which was really, really helpful because at every point, there's what we call a portfolio. So you get a portfolio when you start, when you register with the ROCGP, that's the Royal College of General Practitioners. They give you what they call 14 fish portfolio. And that is your logbook, right? So you write everything that you've been doing in your training. So there needs to be evidence. If there's no evidence, it didn't happen. But when you look at your portfolio, it can be really deceptive because now you're tempted to write a lot of things or tempted to write things that are not necessary. And my trainer made it very clear to me that please don't write a lot of things. I'm not going to read them. You need to be very, very, very brief in your writing. Essentially, what we used to say in medical school was KISS. Keep it short and simple. He was not interested in learning that while I was in A&E, a woman came in shock and I resuscitated her and I used vasopressors. He doesn't really want to know that. He wants to know your capabilities. What are you ticking? What kind of complexities is it meeting? What, in terms of a clinical management, what did this mean to you? And bringing it back to GP, like how relevant is it for you as a GP, not as a hospital doctor? So these are the things that initially my first posting, because you had to do what we call the ESR, your educational supervision review, educational supervisor review. So you do that after every 6 months of your training. So that meant I had to learn how to satisfy what he wanted and also make sure I was satisfying my own training. So developing a personal development plan is very good. You need to have SMART goals. So that means specific, measurable, achievable, relevant, and time bound. He was always drumming that in my ear. So that meeting was one of the things we focused on. You need to make sure that you plan your way around your exam. That was what he told me. Obviously, at that point, what we're writing to now is the AKT, that's Applied Knowledge Test, which you do anytime really. You don't have to do it in your first year, you can do it in your second year. I did it in my second year of GP training. And then it used to be the CSA, now is the simulated consultation assessment, that's the SCA, that you do before you complete your training. You can do it in your third year. So he explained to me that it is a short training program. It's 3 years. Everything is condensed in that 3 years. So you need to make sure you're on your A games. You need to plan your life in a way that this is what I want, this is how I'm going to get there, and you plan for surprises. So I was sure to identify my challenges early on. For example, I knew that after my obs and gynae, I was in my A&E. And most of the people I knew then, my friends, Nigerian friends and all that, they were all writing AKT during the end of the second posting. That's the end of the first year. And I was doing my A&E posting. And I knew there was no way, with the way I was feeling after each shift, drained, like I was barely getting by. My off days were just to rest. I could not write that exam. There's no way I would have prepared. Like, I would pass it. I know I will pass the exam. Sorry, I'm boasting, but I will pass it. But I will not be happy with the attention I would have given it the exam. So I didn't want to add that layer of complexity in my life. I didn't want to stress myself so much that I would hate the process. So I told myself we're not doing this exam until, because the next posting after that was going to be GP posting. So that's sort of where I identify my challenge. And what I found is that most people don't identify their challenges earlier. I'll give you an example. You're struggling in your training. You have maybe you're working with people who are nasty to you, people, or you identify that there are things you need to learn that you're not learning. You identify that you need to go for maybe study leaves, or you just need help around things, but you're not speaking up. And what happens is that because you identify the challenges and you don't work towards it, that affects a lot of other things. And some people will say, oh, I failed this exam because I was stressed, something has happened to me. Some people might go through, life-changing moments, but they didn't take some time out to grieve through it, or to actually just go through it. You just carry on. But at the end of the day, you are there for, say, service provision in the hospital. You meant to be off sick, but you're there, you're working, and then you also now go and do an exam, and that means you will fail. So you need to make sure that at the end of the day, you being the center of everything, the conditions are right for you, and that's what I mean by identifying your challenges early and working towards it and making sure that it doesn't affect much around you. Okay. I'll tell you about the best part of GP training. I do think for me, it was the best part was study budgets and the study days, because that meant you could get a lot of things out of the way. things like your joint injection, you can do your BLS, your basic life support, if you wanted to do anything literally, but you need to make sure it's relevant. You can't be going for a course or a training to learn how to intubate, because how is it relevant as a GP? You can't be going for a course on safe anesthesia for women in obstetrics, because how is that relevant to your training as a GP? So if you go back to it, anything you're doing in this training needs to be relevant to you, because even the other people in the specialties, they are doing what is relevant to them. So this is how you need to tailor your posting. You don't have to just engage in anything you see because it sounds nice. Even if they get to pay for it, for example, you bypass that layer of your dean approving the cost for you, but you're going to write it on your portfolio, and you have to speak to your educational supervisor, and they need to see that you actually committed to developing your skills as a GP. So if your say your portfolio is leaning towards someone who is not even interested in GP and doing something else, why are you really in the specialty? So this is the thing. Now let me talk about GP surgeries, because you do your GP rotation, and I think that's where most people struggle a lot. Most people are really great with hospitals, because as doctors we've been exposed to a lot of hospital posting right from medical school, doing your house job. Most people will have more leaning towards hospital than clinics. Now, the way GP surgeries work in the UK is very different. This is where you get tested a lot for your communication skills and everything as a GP trainee. But today we talk about how GP practice actually runs. So in the GP, you should always remember something. In fact, as in your whole training as a GP trainee, you are supernumerary to anywhere you're working. I'll give you an example. I trained in East Lancashire NHS hospital, right? That's where I did most of my hospital posting. Now, the confusion is that most people think that's a hospital that is paying you, but they are your hosts. That means they're just hosting you for the duration of your training. The people who were paying me was the St. Helens and Nosley. They were the people who were in charge of the GP trainees around the Northwest, right? So they are the ones that were paying me. So you're supernumerary anywhere you're going to. So in the GP practice, in the hospitals, you are supernumerary. You should be able to speak up and say, I'm not enjoying this posting. I'm not getting what I need as a GP trainee. This is not meeting my requirements as a GP trainee. You should be able to complain, because now it's not going to stop your pay. It's not going to do anything rather than trying to investigate that practice or that hospital to make sure that they're actually providing everything you need as a trainee. So you are actually the king if you look at it, because you need to make sure that you as a trainee are comfortable. So if they are not doing anything, if they're not giving you protected time for your learning, if your tutorial times are being used to work in the clinic, if you're not getting adequate supervision, these are things you should complain about and not stomach it, because they are not going to sack you. They are the ones that are going to have to answer for it if you raise these things that are meant to be like very serious issues. So if you do have any concerns around the kind of learning that has been provided to you, the kind of learning environment, the kind of work plan, work structure, you should raise it and not just stomach it, because now as a trainee, you're king. They are meant to make sure that you are getting everything you need for that training, because that means that they're not wasting the money, because they're being paid for you to be there. In the hospital, you're giving to them to provide service, and in return, they should be able to provide learning and that environment for you. In the GP practices, because they're not NHS, they are being paid for you to be there. I think practices receive as much as £10,000 per trainee. So that means everything you need should be provided for you. Do you get it? Yeah. So let me tell you now how GP surgeries work. The GP surgeries work differently from hospitals. The way it works is different. You might feel isolated in GP practice because you don't have like a ward round, you don't have a post take, you don't have, all of that thing that makes hospital busy. You tend to work in isolation, but then it's also a team. Now, when you start off, because you're new, I would always encourage people to ask for a shadowing period, get to see what they are doing, what really happens in terms of seeing patient, but you need to have time to see patients. So they usually will start you off for maybe 30 minutes or 20 minutes, depending on how generous your surgery is. But the general rule sort of is to start you on 20 minutes appointment. And then you need to also have an assigned educational or clinical supervisor each day. And what the role of that person is to make sure your clinics are running okay, to make sure you get a good debrief. Debrief is when you talk about the patients that you've seen and get feedback. Some people want to hear all the cases you've had that day. So they assign you a protected time to go and see that supervisor to talk about your patient. The way it was working for me was I would see my patients and debrief immediately if there was any sort of complex patient I was seeing. Because if I needed them to go to the hospital, at least I could get that opinion before sending them home or sending them anywhere. You know, if it's like a clear-cut case, I can just say, yeah, treat them to go home. And then I'll discuss it later. And the trainer might say, oh, yeah, that's fine. Or book them in for another appointment to see them a follow-up. But I didn't want a case where they've gone home and then I'm calling them and say, oh, sorry, I discussed with my senior colleague and she said you should go to the hospital. So if I identified that there was a sort of complexity to any case I was seeing, I was getting my trainer immediately. Because yeah, we talked about that and he was happy with that, and that was how I operated. So you need to discuss with your trainer how you think you want to operate a clinic. If you want to have the debrief, some of them are happy to do it at the end of the clinic. That means you have to wait. I didn't like that. Waiting to the end of the clinic to, yeah, because I want to go home. I don't want to wait. So at the end of the day, by the time the end of my clinic, I don't have a lot to discuss, but that was how I operated. So you need to find out, but you need to have that time for the brief. You also have protected time for tutorial. Your tutorial time is protected. That means a time you have your trainer to talk about anything. And understanding that is a self-directed learning. So that means that you have to decide what you want to learn, not your trainer. So don't say, oh, my trainer did not, I did not enjoy my tutorial, because you need to decide what you want to learn. So if you have seen a difficult case, if you want to do a simulation of a case, if you want to do a CBD or mini CBDs, if you want anything you really want to do, that is your time. So that's is meant to be 4 hours, because yeah, that's tutorial. But then some people do like a 1 hour and then tell you to go, you can go and do whatever you want to do. Some practices are quite smart and they tell you after 1 hour you go back to work for them. I'm not going to talk about that today because that's between all of you to sort out yourself. I made sure my 4 hours was my 4 hours. If I did 1 hour tutorial, the rest of the 3 hours is for me to do as I like. So you also have your self-directed learning time. So that was also 4 hours. So in GP training, you get 28 hours of clinical time and 12 hours of non-clinical times, of which 4 hours of that non-clinical time is for your what we call VTS. That's your vocational training scheme, where you go my deanery we had Tuesday morning, where every GP trainee had to meet in a certain place, and we had tutors and people who were leading that team, and they come and we talk about different things. We share us into groups. That's your avenue to meet a lot of other GP trainees, have like a chat during the general meetup, and then divide yourselves into group and learn. So that was always protected for us. And then you have 4 hours of your self-directed learning, whatever it is you want to do. If you want to do your portfolio, and that's every week. So if you want to do your portfolio, if you want to do any learning, anything you really want to do, that's up to you. That's 4 hours. And then the 4 hours of a tutorial. Then the remaining 28 hours is for your your working time. So that's it. So I think takeaway from here is obviously everybody's journey is going to be different. You need to identify your whys of wanting to be a GP. When you start, you need to rank the postings you're interested in, and also you need to know how to make the most out of your training, because 3 years it goes by like this. Before you know it, you're done. So you need to know that if whatever it is I'm choosing is relevant to me. You're not going to be the med reg, you're not going to there to be the A&E reg, you're not going to choose postings that are not relevant to you. For example, I'll give you an example. Sorry, I'm going back again. When I chose Obs and Gynae, the great thing was that the department structured a plan for the GP training. So we did not spend any time in the labor ward. We were doing heavily gynae, and postnatal was like maybe 20%. So we're really invested in the gynae part, because that's what you would see as a GP. I think let's say 70% gynae, 15% postnatal and 15% antenatal, because that was very important. You will see pregnant women in your GP surgery. In A&E, I realized I didn't have pediatric posting, but we had a pediatric A&E. So I used to ask them when I come to work, then can I spend some time in the pediatric A&E? And that really helped me, because now as a GP, seeing children, I feel very comfortable with it because I've seen how they present. I know how to identify an unwell child. So all of these were relevant to me, right? So you need to identify what is important to you and make the most of your training. Please don't be like people that say, oh, let's just get through it, because you pay the price when you become a GP. As an independent GP, you need to have some knowledge. So, and that you also need to know how GP surgeries work, how your rotations work. You need to work with your trainer. You need to identify your challenges early on. If you're having issues, if you've had like feedback that are not great, or you're having someone who has not been, maybe a supervisor who is writing not really great in your portfolio, you need to raise it on time. Some people raise issues when the ARCP is approaching, which is like an annual review of competence, where there's a different panel. And now they're seeing all the things they've written on your portfolio that are not nice, and they're judging you based on that. So you need to raise those issues before you get to that point, because then your training will not be miserable for you. I'm actually a very proactive person when it comes to things that are important. And that's the reason why I had like a smooth sail during my GP training, barring every personal things that will happen to you. Your career should not be one of those that are stressing you out. So I took charge of my training. I identified my friends and my foes in every training post I was in, so that I knew the people I would ask for feedback and people I would not ask for feedback. Very important. You cannot go and give everybody your feedback to write for you, because they're going to write trash. They're going to write rubbish. So you need to make sure that you know who is who in these departments. Use your mind eye and look at them. Select everybody. I'm not saying you should be selective in your training, but there's some people that are out to witch hunt. So you need to make sure that they don't smell your portfolio. Smell it, please. Thank you. So yeah, so next video, we're going to talk about communication skills. Really, I think my video, I really want it to be like heavily IMGs, because we are the ones who are new to this country. We are new to the whole thing, and we need to have all of this knowledge. So if you know an IMG, send a video to them. I love to have fun. I like to laugh a lot. So I'll laugh a lot with my video. I'm just chill, not trying to be very serious, but I will really, talk about things that are important, real life experiences. And I'm very happy to read from you. Your comments are really helpful. So let me know what you think about this video, and watch out for the next video. Bye guys.